This is a special edition of the Mike Gallagher Show, Coronavirus in America.
We're using the full power of the federal government to defeat the virus, and that's what we've been doing.
For a while, life is not going to be the way it used to be in the United States.
As we face this national emergency pandemic, now's the time for knowledge and clarity. And this is the place to get it.
We're going into a full crisis footing. This is a wartime dynamic. We have to think about helping each other in different ways.
The president made very decisive decisions quickly.
2020 is definitely going to be one for the history books. And as we take it all in, we know that we'll get through this together. We're America. And now, here's Mike.
Dr. Jerome Adams was formerly the health commissioner of Indiana. He led Indiana's responses to Ebola, Zika, the largest ever HIV outbreak in the United States. He is known as America's doctor. He is the 20th Surgeon General of the United States of America. He holds the rank of Vice Admiral in the U.S. Public Health Service Commission Corps, and it is a distinct honor to welcome the Honorable Surgeon General Jerome Adams to the Mike Gallagher Show. Dr. Adams, it's great having you on the program. I know how busy you must be. Our audience appreciates you taking time for us very, very much, sir.
Well, good day, and I really appreciate your audience. And I sincerely mean that, because one of the most important messages that your listeners can get from our conversation is that we're going to do everything we can from a federal point of view to support them. But this really depends on cooperation at the local level. It depends on people staying at home. It depends on people social distancing. It depends on people washing their hands and practicing good hygiene. That's how we're ultimately going to stop this thing.
And let's talk about the audience of my show and shows like mine and listeners to talk radio all over the country. You appreciate that talk radio listeners are a feisty bunch, an independent bunch. A lot of people are frustrated and nervous about how they're going to pay the bills. There does seem to be, although I've seen a sea change, and I believe the majority of Americans are certainly on board. But what do you say to people who are frustrated about these stay-at-home orders and mandates, and people who are worried about not going out of their house for the next 4 weeks, maybe beyond that? How do you assure people who are skeptical about what we're doing collectively as a people right now?
Well, that is a great question. And I would say that after yesterday, you heard a lot of people reporting out about the somber statistics. 100,000 to 200,000 people could die from this in the United States. But there was some good news that came out of yesterday. And the good news was that when you look at Italy is going down. They've hit their peak and they're coming down after about 3 weeks of these intense efforts. Washington, it looks like they're starting to come down. California looks like they've flattened their curve. And even New York City, and you heard Governor Cuomo say this, looks like their acceleration rates are slowing. So the good news is that if we do these things and we do them really well for 2 to 4 weeks, we know that there is a light at the end of the tunnel. The other important thing for people to know is that the task force and the president really pushed hard to get that rescue package passed, so that people who are staying at home are empowered and enabled, knowing that they can apply for unemployment benefits if necessary, knowing that they're going to get, most likely, most of America is going to get a check, knowing that we're going to have their back while they do the right thing.
Like many Americans, I was riveted by yesterday's briefing. This has become kind of a daily routine for us to watch the president, the task force, Dr. Birx, Dr. Fauci, Vice President Pence. They're so transparent. I mean, yesterday it was like President Trump was like, oh, want to hang out for some more? Whatever you want. He answered every question. I've never seen this kind of transparency from a commander-in-chief like this before. But one of the takeaways was that the task force suggested that on the West Coast, Seattle, the Los Angeles area even, is having a better outcome than New York City right now because of the early mitigation steps that they took. But does weather and density also play a role in the differences in terms of the locations and how they're responding to this virus?
Density absolutely plays a role, but when you look at California, I don't think you would argue that there is a substantial difference in density between most of those major metro areas. Weather, we don't know yet. But what we do know is we're starting to see spread in the southern hemisphere of the planet. And so we are concerned that weather may not take out this virus the way some people are hoping. But again, the good news from the West Coast is that you can actually look at when they instituted their shelter-in-place efforts, and you can see the curve starting to bend. And even in New York City, you see that. So be heartened, people. And you mentioned the frustration at staying at home. I've got 3 kids. I have a 15, a 14, and a 10-year-old plus a dog. I get it. I get cabin fever.
Right.
It's important for people to know that social distancing doesn't mean social disengagement. We still go out for walks. We still go out for hikes. You just stay 6 feet away from everyone else who's out there. We still try to play games. You know, once upon a time, people didn't have all the things that we have to go out to malls and to go out to movie theaters and connect, and they did just fine. So it's a great time to just be with your family and get back to the things that we used to do.
Well, as Dr. Fauci said, I mean, we're going to be in for a tough couple of weeks. We're going to see cases rise. We're going to see, sadly and tragically, more deaths. So, but we've got to stay the course, because if we stop the social distancing, if we stop the avoidance of other people, we're going to see a greater rate of infection and more transmission. I believe most Americans understand that, and indeed, Dr. Fauci said he is seeing glimmers that the social distancing is dampening the spread of COVID-19. Dr. Jerome Adams, the Surgeon General of the United States, joining us here on the Mike Gallagher Show. There's so much we're learning, Dr. Adams, as we go. One of the questions, and I've got people, a lot of this is anecdotal, but we're all sort of sharing anecdotal stories. I know of somebody in New York City who started showing symptoms 19 days ago, wound up, they misplaced the original test. This person got retested yesterday, and the person feels fine, but the test came back positive. And now that's been 19 days since this individual first showed symptoms. Do antibodies stay in your system even after you've gone through the symptoms of the COVID-19, where you're going to show a positive test, but you're healthy and you've kind of gone through it? Are you still and are you still able to be contagious with a positive test like that?
Well, Mike, you bring up some important points, and I'll go through some of them really quickly. First of all, it's important to know that according to the CDC, up to 25% of spread is by asymptomatic carriers, people who didn't have symptoms. And so we're relooking at our recommendations based on the fact that we have seen a significant amount of asymptomatic spread. You brought up antibody testing. Those antibodies actually stay in your system for quite a while. And so as we get more and more antibody testing available, what it's really going to help us do is figure out who had disease beforehand, who were those asymptomatic carriers. And interestingly enough, we expect that the death rate will go down even more as we find out more and more people who actually had the disease, who never even developed symptoms or needed to be hospitalized. But the final point I'd make is that New York did something that was really helpful, and that's that they stood up testing on their own very early. They didn't wait for the CDC test. They didn't wait for these other tests. And so that allowed them to see what was going on within their communities. And now we're doing over 100,000 tests a day, over a 1.1 million tests in the country, and we're getting to a place where we can more reliably feel like we'll be able to say you have a high rate in your community or you have a low rate. And that's going to be key to opening the economy back up again, because we are going to open back up at some point, but we want to be able to know who's got disease, and we want to be able to case, contact, trace them, and isolate them the way we do for people with measles or tuberculosis.
I also know that in New York, frankly, and I know for a fact that they were administering the hydroxychloroquine and Z-Pak sort of cocktail way before people were talking about it across the board. Now I see the governor of Michigan has reversed course on sort of being dubious about it and is requesting the dispensation of that particular medicine, that drug in her state. So we're learning a lot about that as well. Is it too soon to be optimistic about its potential?
It's never too soon to be optimistic, but it's too soon for us to say anything definitively. And you've heard Dr. Fauci express some of his concerns as a scientist. At the end of the day, I can only talk to you as if I were, if it happened to me. If it happened to me or a loved one, I would want to be able to have a conversation with my health provider about what is best, try to save me from what can be a fatal disease. But that
Sure.
doesn't mean that from a medical point of view, we want to tell everyone this is safe, this is effective for all groups, because we don't know that yet. So we're giving people the options from a compassionate use point of view, but we're also making sure we follow up on the data.
Not a one-size-fits-all. Sir, totally understand that, sir. Final question. There's been great conversation recently about masks. I know, again, we're kind of learning as we go. Have you changed your position at all on sort of the seeming resistance to advocating people wearing masks as a preventative measure?
Well, thank you so much for that question, because I really want to clarify this for the American people and for your listeners. The CDC, the World Health Organization, my office originally recommended against the general public wearing masks because the totality of the scientific data at that point in time was not in favor of people wearing masks as a way of protecting themselves from getting the novel coronavirus. Now, we've always said we're going to continue to learn, we're going to continue to adapt what we say and what we recommend. And I mentioned the asymptomatic transmission earlier. Based on that, we have asked, the task force has asked the CDC to take a look at new data to determine whether or not advising more people to wear a mask will prevent them from transmitting the disease to others. So that's different than saying it will protect you. But the most important thing for people to remember is that whether you wear a mask or not, you still need to social distance. The best way to not get coronavirus is to stay at home and not be around other people who have coronavirus. If you are going to wear a facial covering, number one, wash your hands before you put it on. Number two, don't touch your face while you're wearing it, because you could potentially introduce germs to your face. And we know when people put on facial coverings, they tend to touch their face. Number three, you don't need an N95 mask. Save those for the health professionals, because that's who is fitted and knows how to wear them properly and who needs them to protect themselves. And then number four, again, this can't be at the expense of social distancing.
Amen to all of it, Dr. Adams, Surgeon General Adams. I'm so grateful for your time. Our audience appreciates you joining us and helping us guide us through these troubled times. All the best. Keep fighting the good fight, sir. We're praying for you and your entire team.
Thank you. We'll get through this together. 30 days to stop the spread at coronavirus.gov.
You got it. Thank you, sir. Appreciate you joining us. That's the Surgeon General of the United States, Vice Admiral Jerome Adams, the 20th Surgeon General of the United States.